Harm reduction advice is a foundation practice process for youth alcohol and drug workers. It's designed for working with young people who are using drugs. It's for when our prevention approaches have failed and instead someone has made the choice to use alcohol or other drugs. What are some strategies that we can give young people to help keep them safe? And I'm going to take you through a few of the key principles around how to do that today. Right message. It's about delivering the right information. That means sometimes you've got to know your stuff. You've got to know the drugs. You've got to know how young people actually use them in practice. Delivering it to the right young person. We don't give harm reduction advice to young people who aren't using drugs. If a young person doesn't currently smoke cannabis, we don't do harm reduction around cannabis for them. We deliver harm reduction messages to the right young person. Doing it in the right time and place. It's not a great time if a young person is in a crisis or struggling with other issues in their lives. If they're not able to take on board the information that we're giving them, then maybe choose another time. To have a balance between aspirational and realistic advice. We might aspire to give young people the information around the safest possible way to use, but we know that they're not able to implement that. So if they can't implement the safest possible option that we've got, well, what's the second best option we can give them? How is it that we balance our goal to keep them safe all the time versus the reality that they're in? Given the range of factors involved in drug-related harm, it can be tricky for workers to know where to start. What we try to think about is the way harm can occur can be across the drug, the set, or the setting. Drug is obviously referring to the chemical itself. There are harms associated with particular drugs just by their pharmacological action. There's also harms associated with the set, and the set is referring to the physical characteristics of the person involved. It might be their weight or their age. It might be pre-existing other health problems. The set is about the characteristics of the individual. The third factor, the setting, is referring to the physical environment in which the substance use is occurring. A lot of young people are uniquely at risk from the setting because a lot of adults take drugs at home or at the pub or in a nightclub. A lot of young people use alcohol and drugs in uncontrolled environments, like in parks or in houses where there are no parents around and no one to supervise. When we think about drug-related harm and how to reduce it, think about the drug, the set, and the setting. There's a whole bunch of generic harm reduction messages that you can give any young person that uses alcohol and other drugs. The first one is related to what I was just talking about, which is around using in safer places. We know that public space is a dangerous place to use substances in, so just talking to a young person about where they use alcohol and other drugs is a good harm reduction strategy. We know that a lot of young people don't consider legal harms when they think about taking alcohol or other drugs, and it's useful as a worker to know what those might be and to talk to them about that. It might be the case that a particular quantity of a substance, if they go over that, they might be charged with, say, supply, but if they keep their quantities quite low, they might be eligible for a diversion. Getting young people to understand how alcohol and other drugs affects their mood and mental state. If they're having a bad day, if they're angry, if they're sad, using alcohol and other drugs on top of that can amplify those negative feelings that they've got. Look after your mates and know when to get help. We know that there have been plenty of cases of young people who are too scared to call for assistance, either an ambulance or someone to help them, and because they're often scared of police or getting in trouble from their parents. All alcohol and drug workers should have conversations with young people about safety and how to call an ambulance. What happens when you call 000? When do you call 000? How do you know if your friend really needs some help? We know that young people can experience a range of harms trying to get access to alcohol and other drugs. We know the illicit drug market is obviously illegal and young people can be exploited, they can be assaulted, they can have money stolen off them, they can bring them into contact with people they otherwise wouldn't have contact with. We also know, though, that even accessing tobacco, we know young people can approach strangers on the street and hit them up for cigarettes. And we know that in that context, some young people do end up being exploited and at risk of harm from their practices involved in accessing alcohol and other drugs. it's a worthwhile conversation to have with young people around the dangers of mixing drugs and why you wouldn't do that, and just even how it is that can amplify the harms that they might experience. As I mentioned during the presentation, a lot of harms are associated with specific substances, and we haven't had time to go into all the different drugs today. So do yourself a favour and find out about all those different drugs and what sort of harms they might have.